Douglas County is a beacon of hope and progress for improving the health of our community families. Programming alone won't cut it, but that policy and systems change must be the focus.
LiveWell Lawrence, we focus on policy, systems, and environment change because really we're trying to make the healthy choice the easy choice.
A culture of health, to me, represents a community that knows how to care for each other and itself.
The reality is that wellness needs to be an integral part of healthy living.
You get a highly trained workforce is going to really improve the health of your entire community.
Building from local evidence consistently pointing to social determinants of health, community leaders explored ways to work together to make it easier for residents to be healthy. LiveWell Lawrence formed in 2011 to help break down the barriers to these changes, and its greatest resource is its collaborative partnerships between coalition members.
We have a ton of momentum in our community right now to really work on the built environment from the trails and bicycle and pedestrian activity side. LiveWell has been a great partner in supporting this work in the city. I think probably one of our best policy successes was the passage of a Complete Streets policy with the Lawrence City Commission. We're focusing on a network of transportation options for people. And we're doing it strategically in a way that connects a network around the city so that people can get from work to school, back home. LiveWell Lawrence is really tackling what this community was unable to do before because we were all in our individual silos. But LiveWell has given us this umbrella to come together and to say, these are the shared values that we have, and let's work together.
Within the Lawrence Public School District, Kennedy Elementary is also harnessing the collective power of collaborations to help better serve its students.
This is an illustration of the community rallying around a school that needed additional support. I think it illustrates really what we're capable of as a community when leaders come together and find some common ground, when we all decide that assuring that children have the greatest possible experience both in the community and in school, we can make some huge progress, and that's really what Kennedy illustrates.
This pipeline from pre-K to success beyond school continues with Lawrence Public Schools' Career Pathways program.
We have an advisory committee for all 19 of our career pathways, which involves people from business and industry. And they help us understand what are the skills and opportunities kids need to be successful in those different career areas that students are interested in. Those opportunities include mentorship opportunities for kids, community college courses while they're still in high school, and also provide that same kind of support for our adult learners in our community so that they'll be working side by side. So it's a really dynamic ability to bring that kind of training to what has been sort of a vocational training or a career and technical training desert here in Lawrence.
With a focus on clinical care that is sensitive to social and economic factors, Healthcare Access Clinic is creating an equal opportunity for health in Douglas County.
It's necessary to become healthy, but it's very difficult for our individuals to be able to afford. So providing that care right here in their medical home where they're already being seen for counseling and for primary care makes it a lot easier to do that. If they need specialty care, if they need other resources in town, we can connect them with our social work. What we've developed is a wellness program on site that is free of charge to our patients. Our wellness program partners with our primary care in that our providers prescribe wellness the same way they would prescribe medication.
We are attacking the roots of health disparities through policy interventions and innovative partnerships, while leveraging our scarce resources to build a healthy community for all.